Today we are going to discuss the second part of uh, this vascular system. In the previous lecture we discussed about the arterial system, and in this lecture we are going to discuss about the uh, venous system. So why we are studying this thing? Because there is a lot common venous disorders. For example, the most common one is varicose veins, and though there are other venous conditions as well, but they are not so common. Of course, we are going to discuss a little about them as well. So, to start with, in the previous lecture, I was talking about uh, the important, what you can say, arterial conditions, and also I talk about the ulcerations, and I give a small introduction about the location of the arterial ulcers as well as the venous ulcers, right? So, veins are a part of a very complex system, and of course, what is the function of the veins is to take the blood towards the heart, okay, or return the blood towards the heart. And the veins are doing this thing against the gravity, and that's why the venous blood flow is dependent on multiple factors such as gravity. There are valves, uh, the heart condition, the blood volume, the calf muscles, and all those things. So, a little introduction about venous veins. We are going to discuss how many, what kind of veins are there, what are the systems, and then we are going to discuss the conditions. So, as you can see, like 20% of American women, 7% of American men suffer from venous disease, right? And these are the most common, you can say, symptoms like aching, fatigue, swelling, and pain in the legs. But like these are the symptoms which can occur as a result of some vein conditions. So, and there are some cosmetic issues as well, and there are leg ulcers also which develop due to venous conditions, right? Okay. Of course, we are studying venous system, and we are not specifically studying the lower limb, right? We are studying, rather, you can say, all the vein system in the body. So, the understanding of venous physiology and anatomy is very, very important um, for the medical students, for the surgeons, to operate on them or to diagnose the condition. So, now there are basically two main venous system in the body. One is called a superficial venous system, and then there is the deep venous system. Okay. This you can say figure which is in front of you is of course like um, in relation to the distribution of varicose veins. But right now I'm not talking about any disease, rather I'm talking about um, basics of anatomy and physiology, right? So the superficial venous system, in this case above of the lower extremity, basically all these superficial veins drain into the deep veins, right? So for example, you can see over here there is a great saphenous vein. This is the short saphenous vein, and this is the great saphenous vein, right? Or the long saphenous vein. So you can see like it's going from down to up, okay? And this one is basically draining into the femoral vein, okay? And now, of course, like it takes a lot of other tributaries or small veins like transverse patellar vein or lateral superficial femoral vein. So it takes a lot of small veins or tributaries before reaching the inguinal region and draining into the femoral vein. So this is one of the vein, and then there is a short saphenous vein, as you can see over here, which is running on the back of the leg, and see this one is draining into the popliteal vein, right? So the thing is that okay, this one makes the superficial venous system, and the understanding of this like superficial and deep venous system as well as the perforators is very important, especially to understand the varicose veins. So the long saphenous vein, and then there is a short saphenous vein or small saphenous vein. You can see like it's arising from where the dorsal arch of the foot or lateral foot, and then it ascends posteriorly, and then it reaches to the popliteal region, and then it drains into the popliteal vein. Okay. Other than that, okay, this one is again what you can say a diagram. You can see over here. Just to make you understand, of course, it's not exactly what you can say anatomically correct, but of course it's just to give you the concept. The long saphenous vein, the short saphenous vein, the perforators, and the deep venous system. Okay, let's talk about the deep venous system. Basically, there is the veins of the feet, okay? We call them as plantar digital veins. There is a plantar arch over here, venous arch. And then like this one, they started rising up as a medial and lateral plantar veins, which then drain into the posterior tibial veins, and the posterior tibial veins then they ascend or they continue, okay, and then they join the popliteal vein, and what you can say like it will go up. See, this one is popliteal vein, okay, and it goes up and getting what you can say other veins. It basically become the femoral vein over here, right? So of course like popliteal vein then becomes the femoral vein after taking others as well, some perforators, and there is the great saphenous vein. As I told you before, it drains into the femoral vein, and then this femoral vein basically drain into the iliac veins, okay, or external iliac vein. See this one, external iliac vein. And then of course like the external and internal iliac vein, they become a common iliac vein, which ascend upwards and they become inferior vena cava, right? So see, Great and short saphenous vein are superficial veins, whereas like these are the deep veins, which are deep inside the limb. Uh, Same thing happens in the upper limb as well, but of course, like varicose veins are related to the lower limb. So that's why I started discussing this lower limb venous system. And then there is a lot of perforating veins. You can see over here, perforators are there, right? So what are the perforator veins? So perforating veins are basically you can see this one, this one, this one, this one, or these one. What are these? They connect the superficial venous system with the deep venous system, right? Superficial veins connect the superficial venous system with the deep venous system, and they penetrate through the facial layers of the lower extremities. So uh, now one of the thing is that this one, like they are showing you some perforator veins. Again, then there is a lot of variations. There is a lot of variability in this one. Like it's not like this. Like everyone have like three hair, one hair, or two hair, or three hair. It could be variable. It varies from person to person. But the important thing is to understand what is the function of the perforators. That like they name them as well. No need to remember their names. For example, you can see over here, these are cocket perforators. This one, cocket 1, cocket 2, cocket 3, right? So you can see over here, cocket 1, cocket 2, cocket 3. So like some of them, they have named them cockets perforator, which connect the posterior arch and the posterior tibial veins. And then there are some of them, they are named as Boyd's perforators, which connect the greater saphenous vein and the gastrocnemius veins. These are the Boyd perforators. Okay. We don't have to remember the names, but the important thing is remember, like there are some 3 to 4 perforators over here. Then above the knee, there are perforators, right? And then there is Hunterian and Dodds. See, Dodds femoral vein. Okay. Dodds perforator. Sorry, this is Dodds perforator, right? Which connect the great saphenous veins to the superficial saphenous vein, right? So there is a lot of perforators simply. Now, what is the importance of about perforator is simply one thing. They have the valves. You can see over here. Valves, okay? They have the valves. So what is the function of the valves? Of course, like we have valves in the heart, we have valves again, uh, for example, in many of the machines or in many of the pipes. So what is the function of the valve? Remember, the valves prevent the backflow, prevents the reflux. Okay. So see, the superficial veins drain into the deep veins. There are perforators which connect them. And what is the function of the perforators? They prevent the backflow. Okay, so remember, they have the valves, and when the valves are incompetent, or when the valves are not functioning well, so there could be backflow to the blood. This is the important thing to understand. Okay, and we name this thing as venous insufficiency. So what is venous insufficiency? When the veins cannot perform their function properly, the same like aortic insufficiency or mitral insufficiency or incompetency or regurgitation. Simply when they cannot function there, when the valves are not functioning properly, so we call it as insufficiency. So there are basically, there are 3 categories of venous insufficiency: congenital, primary, and secondary. For example, some persons, they have congenital abnormalities, right? There's a syndrome called as Kippel-Trenaunay syndrome, and then there is primary venous insufficiencies as well. like which are acquired, and then there is secondary one which basically arises due to something like a thrombus, for example. Okay, so anyhow, we are going to discuss these things in more detail. I hope you understand the concept. So the superficial veins drain into the deep veins by the help of the perforators, and the calf muscles play a lot of role in that. The venous walls play a lot of role in that. And I remember this thing that, you know, the pressure in the veins is very low, okay? And near the right atrium, it reaches to -5 millimeter of mercury. And of course the pressure is more towards the feet. For example, the foot veins, when someone is standing, they have too much pressure, of course, because there is gravity also. And then because of the calf muscles pump action, it um, let the blood flow against the gravity towards the heart. Okay, and so simply whenever we walk, our calf muscles, they get contracted, they push the blood upwards towards the heart. Okay, so of course the calf muscles, they compress the veins, and when the veins are compressed, they pump the blood upwards. Okay, so this is one of the thing, like whenever we travel by air and the travel is long, they always say that uh, do some exercises like uh, press your calf muscles and all the stuff, or take a walk after every 1 hour or something like this. Okay, so why? Because they just want to keep your blood flowing in the veins, because sometimes the people make suffer from DVT, like which is deep venous thrombosis, and that is because of stasis, like when the blood is staying at one place for too long. This thing can happen. So anyhow, let's start. Like, let's go further and to talk further about this one. Remember that the veins are thin walled. They are highly distendable, and of course, like when they have to hold more water, like more fluid, they can become, or more blood, they become more distended. Uh, but they are collapsible as well. Okay, and what you can say, uh, the veins intima, they are composed of a non-thrombogenic endothelium. Okay, so why? Because um, we don't want the platelets to get aggregated over there for thrombus formation. But of course, like whenever there is some injury, inflammation, thrombus can form over there. So all these things, uh, play a role. So this one was about the uh, lower limb veins, but the upper limb veins, they are no different. They also have the same, the deep and the superficial venous system, and simply the superficial veins, they like there is one is cephalic vein, one is basilic vein, and simply they drain into the deep veins in the upper limb, right? And same thing goes, but and like ultimately, like the same story which is in the lower limb. In the upper limb, there is axillary vein, which basically becomes the cephalic vein, and which drain into the heart simply. Why I'm discussing this thing, because okay, we are not going to discuss much of the things related to the upper limb. Of course, we will be focusing on the lower limb mostly, right? Okay, so going further in this one is uh, these are the explanation which I already talked about: Boyd's perforator or Cockett's perforators, or all this one. So again, this thing, when the walls of the perforator veins become incompetent, they can cause insufficiency of the blood flow, and there could be reflux, which can result into pooling up of the blood over there, development of the venous ulcers, and When we'll discuss the condition more, you would understand. Okay, so leave this thing for a while. For example, this one you can see over here. Uh, the skin, the fats, the muscles, the deep veins, and the superficial veins. So when the walls are uh, competent, the blood keep on flowing in this direction. But see, this valve is not working, or this one is not working. The blood is pulling up in the superficial veins, and see, uh, now the anatomy is all distorted, right? So now, for example, there are three main anatomic categories of primary venous insufficiency. One is called as telangiectasias, one is called as reticular veins, and one is called as varicose veins. So you can see over here spiders, reticular veins, and varicose veins, right? So as you know, like telangiectasias are what? They are very small, bluish type of vessels which we can see on the body, right? So now the important thing to okay, many people they have telangiectasia on the lower limb especially. It doesn't mean like they have varicose veins. Remember this thing, right? But uh, reticular veins are basically the veins, or these are the, you can say, the branches which enter into the uh, superficial veins, and then the superficial veins, they drain into the deep veins. So now, as I told you, one of the thing is, the valve abnormalities which you can see over here, right? uh, which can result into the formation of varicose veins. But of course, like, there are many other things like which we are going to discuss in this one. Okay, uh, one of the concepts which I wanted to give you before starting is let me check if we have any photograph to show that thing to you. Okay, for example, look at this one. Whenever there is pooling up of the blood in the veins, there are not just mechanical abnormalities which can occur, like the collection of the blood, okay? Rather, there are some cellular abnormalities, or you can say uh, molecular level abnormalities can occur as well. For example, I will tell you now that when the blood is staying at one place uh, for a long period of time, no matter what is the abnormality. For example, abnormality can be like um a DVT, right? A DVT, deep venous thrombosis, which is basically blocking the blood flow from the veins, right? So, what is going to happen? That there is a lot of macrophages and monocytes in the blood which are going to infiltrate in those veins, okay? Now, chronically, what will happen that due to pulling off of up of this blood, uh, there are many things which can occur. For example, one thing is called as Lipo Dermatosclerosis, and the blood, when it's started leaking from the capillaries, uh, what happens is uh, uh, what happens is, like, there is collection of the fibrinogen, okay, and there is, what you can say, a collection of a lot of uh, pigments, okay. So all these things, they will start displaying on the skin. So and when we do physical examination, of course we see all of these things, right? So now, how we evaluate, for example, like, of course, I haven't started talking about any condition yet, but like, I'm just talking about the basics of the venous conditions, right? the changes and all the stuff. So whenever we are going to clinically evaluate any patient for venous diseases, what are the things we have to do? We have to take history, we have to do physical examination. Okay, so uh, of course, as I told you, there could be primary, congenital, primary, or secondary conditions, and secondary conditions, especially like as a result of DVT. So, for example, you will ask the patient either the condition they are suffering from is acute or chronic, and if it is acute, when it started, or if it is chronic, how long it is there, what is their age, and either they have any history of malignancy, thromboembolism, trauma, hospitalization, immobilization. In females, especially pregnancy is very important. Oral contraceptive pills is very important. Hormone replacement therapy is very important. Or any kind of hypercoagulable state which can lead to DVT formation, for example. So we are going to evaluate everyone on that basis. And then, of course, we go for examination. So examination, we remember, like whenever there is a pair, always compare. We are going to see both of the limbs, like either they are of equal size, color, temperature, any visible or palpable signs of veins, okay, and uh, all the things, of course, like we will do on the examination. There are some special tests as well. I'm going to talk about them in detail in a while, and of course, like. If it's a chronic condition, so maybe you will find the chronic changes of the skin, which I talk about, like the characteristic changes of chronic venous insufficiency, like uh, what you can say, for example, yes, that Lipo Dermatosclerosis, for example, right? So of course, like we are going to see all these things, right? Any spider angiomatas, which are distended intradermal venules, which I show you, right? So they are called as spider angiomatas. So we are going to talk about uh, all these things. We will see like if there is any fibrosis. Why? Because chronically, fibrosis can occur, and due to chronic inflammation, there could be fat necrosis, and collectively we call it as lipodermatosclerosis. And as I told you, that pigment deposition, like hemosiderin deposition, because of the cells, the blood started leaking out from the capillaries, for example. Okay, what happens, like there is characteristic pigmentation of chronic venous diseases. Okay, that is because of hemosiderin deposition. So that thing we will see for any ulcers, if they have any ulcers, right? And especially I told you that the ulcers are present in like here, just above the medial malleolus. And then of course, like we will go for some testings like Trendelenburg test and all those things. So this is we are going to proceed. So now um, again, like this is like the normal blood flow and the venous insufficiency. Okay, so see, these are telangiectasias, which are very, very small net-like structure. This is, of course, varicose veins, quite visible. This is the lipodermatosclerotic changes. This is superficial phlebitis. Phlebitis is inflammation. And this is venous ulceration. Okay, so now, telangiectasias, as I told you, right? Here, they wanted to tell you how telangiectasias, they arise. So of course, like whenever you will go for a physical examination, you will see like either you can see an telangiectasias or not, right? And this one is like they're showing you this thing. You will see either they have any varicose veins, a very visible bag of worms in the skin, right? This is varicose veins. See. Okay. So of course, like whenever anyone present with varicose veins, uh, the dilated veins, varicose veins are simply defined as tortuous dilated veins. Okay. So first of all, we always see either they are in the territory of the small, short saphenous vein, or either they are in the territory of the large saphenous vein. Okay. So this thing to check for the location again, varicose veins, and then of course we check for any signs or symptoms of signs of what you can say chronic venous insufficiency, like hyperpigmentation, hemosiderin deposition, Lipo Dermatosclerosis. Okay, so see, like this is the Lipo Dermatosclerosis right here, or here you can see over here. So now what happens is, like we call it as champagne. We call it as champagne bottle leg. Okay, fibrotic, hypertrophic skin, and hyperpigmentation. Okay, so this thing is important now to look. Okay. We check for any venous stasis ulcers, for example this one, and these are generally not painful, and they are just above the medial malleolus, right? So you can see like this one. Okay. This is a Trendelenburg test they are doing. Okay, I will talk about this one soon. Okay. Now I will specifically talk about what you can say varicose veins, right? Okay, as I told you how we can define varicose veins, it is like simply tortuous. I'm sorry, it's like, sorry, okay. Okay, it is tortuous dilated veins, right? So now this varicose veins, they are very common, and what happens is like they are very common, like in adult population especially, and what happens is like they run a lot of studies, and what they found, like many of the people, they have defective connective tissue, and that's why they develop varicose veins. Okay, but like this is the primary cause. So varicose vein can be primary or secondary. Okay, we can go in this way, better way, and wherever it is primary, so of course, like most commonly it is due to some connective tissue disorder. But whenever it is secondary to something, so of course, like it could be secondary to incompetent walls or anything, like for example thrombosis, right? So or like incompetence of walls due to any other reason. There are many risk factors which are recognized risk factors for varicose veins, like pregnancy, pelvic tumors, and things like this, right? So now anyone, like whenever they have varicose veins, of course they come to the doctor, and generally they don't have any severe type of symptoms, like because varicose veins, they seldom gives any severe symptoms. Okay, like most of the people basically they come due to cosmetic reasons, and most of the people basically they come because they feel uncomfortable. Okay, they feel uncomfortable, they feel like they feel like some discomfort or dull type of aching pain. Okay, most of the people they come for this thing. Okay, so what happens is many people they come because sometimes like after prolonged standing they have this varicose veins at the end of the day. Okay, uh, many people, by the way, they never consult the doctor. So anyhow, the symptoms are not so severe, but whenever they are like they are more type of discomfort, they are more like of discomfort rather than too much severe pain or things like this. Some of the people they have swelling, itching, and stuff like this. Okay, so of course when the patient will come and you found that someone have varicose veins, of course on examination we see or we go to see the symptoms like any chronic venous insufficiencies changes like Lipo Dermatosclerosis or ulceration or pigmentation, right? So now, one of the things which I told you, like whenever anyone have varicose veins, the first thing is to identify either it's in the short saphenous vein territory or either it's in a large saphenous vein territory. Okay, so of course, like someone who have the varicose veins in the thigh, so this thing will make it clear that that it is the long saphenous vein incompetence, for example, right? But whenever it is in the back of the leg, for example, um, okay, back of the leg, like this one, okay. So what you can say, the back of the leg, here, it could be due to short saphenous vein incompetency. But sometimes, the varicose veins, uh, they are of the both short and the long saphenous vein, simply. So we look for the reticular veins, we look for the telangiectasias, and we look for all these things. We look for the chronic venous insufficiency signs like the Lipo Dermatosclerosis, like pigmentation, and all these things, right? So these are all the things we do. And remember, like whenever you have to examine, always go like this way. Look, feel, and move. So look means inspection. On inspection, you will see either it's a short or a long saphenous vein. Okay, and what you can say, then we can feel the temperature of the leg, we can percuss, we can feel the veins, okay, and all those things, and then we can move. Okay, move in this one case is not so important. So anyhow, one of the tests which they do is called as Trendelenburg test, okay, or the Brody Trendelenburg test, you can see over here. Now I would rather suggest you guys to see a video on YouTube where I like to understand this test in a good detail. Uh, okay, one of the things which I must tell you is uh, these kind of tests are obsolete now because nowadays we have Dopplers, we have a lot of investigations available. So like the doctors they directly go into the investigation, but you must know what is this one, what are these tests, okay? Okay, you can see over here that the body dynamic test number A, the limb is raised. Okay, when the limb is raised, so what will happen? Like all the veins are going to drain back into the deep venous system. Okay, so the varicose veins, basically, which are visible on standing, and when the patient will lay down and you are going to raise their leg, what happens? The blood drains away. Okay, so this is what they do, so that varicose veins will disappear. If you will come onto the figure B, so what he is doing, the doctor, the physician, is like he is putting his fingers on the saphenous opening. Okay, so why he's putting his fingers on the saphenous opening? Because there is a valve over here. So if this valve is not working, so he is basically blocking the backflow of the blood from the deep veins to the superficial veins by the help of his fingers, right? And see, we cannot see any visible venous varicose veins, right? And then he removed his hand, he removed the pressure, okay? And soon as he removed the pressure, see what happens, all the veins, they started filling, okay? So it means the test is positive, which means that this valve is incompetent, this valve is not functioning properly, this valve is not preventing the backflow, right? So this is called as the Brody Trendelenburg test or Tonic test. Okay, Tonic tests are nowadays are not done by much of the physicians, but what they do is again the same thing. They raise the leg of the patient, and what they do, they put a tonic way, they tie it, and then they ask the patient to stand up, and they see either they're developing any varicose veins or not. So now there are some what you can say other things as well. For example, you can place the tonic way a little below, just to check for the perforators and all these things. Okay, or you can, there is one of the tests in which like they can tie 3 tonic ways and then releasing one by one to see like at what level is there is the incompetences there. Okay, but uh, remember that the great saphenous incompetence is uh, the cause of the varicose veins in 80% of the patients. So uh, this test, is going to diagnose, or you can say is going to tell you the results in 80% of the cases simply. Okay, so but like again, I would suggest you to see this Tonico test, in detail on Facebook, on YouTube, of course, like to make a better concept, right? Also, you can say that uh, when you put the hand over here, you can ask the patient to cough as well, because sometimes you can feel a thrill while the patient is coughing. Okay, so that is again a sign that there is uh, backflow of the blood. Not so sensitive or specific test, but okay, this can be done. Okay, so see the signs and the symptoms. The examination I talked about before, and then this is the specific look, feel, and move. So this one is the specific special test, Trendelenburg test, which you can do to check for the saphenous vein incompetence. And then we can go for investigation. Uh, okay, so investigations, of course, like duplex or Doppler scanning is the best thing. Okay, you can do simply nowadays, because that gives what you can say the best. The Doppler give the best, you can say, estimate. Okay, what is the condition? So, like I told you before, like what is Doppler? It's a handheld device, and it simply uh, give us the sound, or it emits the sound when the blood flows through that probe or like below that probe. So simply nowadays, this instead of this Trendelenburg test or this Tourniquet test, if we have Dopplers, what they do, like they just put the Doppler probe on the saphenous opening or around the calf muscles. So simply like that Doppler probe can simply give us the findings. Okay, what part of the vein is incompetent or where there is abnormal blood flow. Uh, One of the tests which is available is also called as duplex ultrasound imaging, and again that is related to the blood flow. There is varicography, there is venography, but like not used too much. Okay, so the diagnosis is by Dopplers most of the time nowadays. Then comes the management. Okay, now you can see in this photograph like what they're doing, like they marked all the veins, okay, the superficial veins which are seen. Okay, the management largely depends on what is the condition of the limb. For example, if there is any chronic changes like Lipo Dermatosclerosis, or there is no changes. For example, someone who don't have changes or chronic changes, what can be done is simply a reassurance, okay? But surgery is mostly done for cosmetic reasons, okay? And that's the reasons more females come for surgeries rather than males, because the females, they are more concerned about their appearance, okay? So they go for the surgery, they wanted to remove that, okay? But so you can say like one of the indication for surgery is simply due to cosmetic reasons, okay? The other indications to go for surgery is someone who have chronic changes like ulcerations or lipodermatosclerosis, okay? Or someone who have, for example, recent episode of hemorrhages, okay? In them, of course, like we can do for go for surgery. But otherwise, the patients can be treated by compression stockings, okay? So what you can say, especially when someone have the history of thrombus, right? So we can give them stockings, or you can say elastic compression stockings, okay? So basically what these stockings do, like they keep on putting pressure on the skin, so they don't allow the superficial veins to uh, like to collect more and more, what you can say, blood. Okay, so in other words, you can say what is this? Sorry. Okay, so you can say like management, right? In this case, is simply number one is reassurance. If there is no chronic changes, right? Uh, number second is what you can say, uh, if indications are there, so go for surgery, right? And I talk about the indications. Number three is simply compression stockings, right? In case of thrombotic history. Okay, one of the treatment therapy which is available is called as injection sclerotherapy. Okay, what is this one? So simple to understand. In this one, what they do, they inject a sclerosing agent inside that vein. Okay, so for example, sodium tetradecyl sulfate is one of the thing. Okay, so what this sclerosing agent do, it basically destroy the endothelial cells, and uh, which will lead to fibrosis and fusion of that place, and basically that place is obliterated or finished, right? So of course, like once it is done, uh, the patient, uh, sorry, okay, the patient, of course, like what will happen is like when that place is gone, so for sure, like there is no uh, when the place is gone, so simply what will happen that like no blood can collect in that one. So there is one technique called as ultrasound guided foam sclerotherapy as well, right? So this thing, okay, sorry. Okay. So this thing. And of course, like the last resort in this case is if these things are not working, then we go for surgery. Okay. So when it comes to surgery, by the way, what is the thing, okay, so that those techniques are preferred because surgeries, of course, like are like need some hospital admission and all these things. Okay, need more time for recovery. So in this one, you can see over here, first of all, they mark the places. Okay, and after marking, what they do, like basically they do vein stripping. Okay, see, make a cut over here, make a cut over here, and strip it all out. Okay, this is called as what? Vein stripping. Okay, so this vein stripping is done. You can see over here, these are the markings they have done before surgery. Okay, like these veins they have to strip out, and if you can see over here, they are stripping out the vein, taking it out. Okay, of course, like when these veins are stripped out, so there is no more veins there is no more uh, varicose veins. Saphenofemoral ligation can be done as well. Okay, so this is all about varicose veins, and after varicose veins, guys, I will talk a very little about deep venous thrombosis. We have covered that thing already. We have done pulmonary embolism. You have done pulmonary embolism, and pulmonary embolism and DVT, they are considered as same conditions. If you know the risk factors for pulmonary embolism, you must know the risk factors for deep venous thrombosis. So simply, what is deep venous thrombosis? It's a clot formation or thrombus formation inside the deep vein. And what are the reasons behind that? Simply, uh, wait. If you remember that which was tried, like stasis and trauma or the hypercoagulable state. So remember, like, anyone who have any hypercoagulable state, like cancers, like pregnancy, on medications, or thrombophilic disorders, or someone who have a history of trauma or immobilization for a long period of time, especially surgeries in the lower abdomen, they can develop thrombus. Okay, so usually they are formed in the calf veins and then they ascend upwards. 80 to 90% of the pulmonary emboli originate in the calf veins, and you can see like what is the clinical presentation. The patient may present with calf or thigh pain, not always. It could be asymptomatic, it could be without any signs or symptoms, right? So the patient may present with calf pain, thigh pain, edema. What is Homan sign? Homan sign is like when we dorsiflex the foot of the patient, they feel pain in the calf. And see, many of them, they are asymptomatic, as I was talking about, right? And some of the patients, they present with pulmonary embolism directly. And pulmonary embolism sometimes can be very fatal, like can kill the patient. So again, diagnosis can be done by a lot of bloods can be done. If you remember pulmonary embolism, D dimers, and clotting profile, we will check, we will do CBC, we will go for duplex ultrasound, okay, to see. So Doppler ultrasound flow examination should be done. Okay, so or venography can be done, same like what we have discussed before. And what is the treatment of DVT? It's same like what is the treatment for what you can say pulmonary embolism. Of course, we put the patient on heparin. We give them thrombolytic drugs. If someone have recurrent, we put them with inferior vena cava filters, right? And prevention can be done by leg elevation, early mobilization after surgery, the use of support, correction of preoperative risk factors, intermittent calf compressions by means of a pneumatic calf, someone who is bedridden, put the patient on heparin and all this stuff. So these things can be done. Some of the complications of DVT, phlegmasia alba dolens or cerulean dolens, or there's something called as post phlebitic syndrome or pulmonary embolism. What is alba dolens? Okay, when there is occlusion of the iliac and femoral veins, basically what will happen, the leg become pale, cool, and the arterial veins pulsations are gone because of spasm. Okay, so for example, this one you can see over here. You can see these two, right? There is swelling here, and what happens when you will try to take the arterial pulsation, you will not find anything. So see a lot of edema, inflammation, all this stuff. And this is the photograph of venous gangrene. So this is alba dolens. And this one is cerulean dolens. So this is secondary to acute and nearly total venous occlusion of the extremity outflow, including the iliac and femoral veins. Most common in left leg. And 30% of cases occur in post-operative and postpartum patient, and can be due to, you can say, pelvic malignancies. So physical findings in this case have they have the cyanosis, they have edema, severe pain, absent pulses, and can lead to venous gangrene. And of course, the treatment will remain same, which is thrombolytic therapy, thrombectomy, bed rest with leg elevation to drain out the blood. Then there is post-phlebitic syndrome. This is again a common complication of DVT, and this is simply there's inflammation in that area, and what will happen, the patient will present with swelling and ulceration, leg edema, or local superficial venous hypertension. Okay, so this one, and okay, this brownie induration is due to hemosiderin deposition, as I told you before. Okay, so and of course, one of the complication is very important complication is, of course, pulmonary embolism. Okay, whenever anyone have what you can say a chronic type of problem like this, DVT, we put them on warfarin. Okay, this is the example of what you can say the venous ulcer. If you can see over here, venous ulcer in this patient, right? Okay, all this dolens and all this stuff is what, this is basically post thrombotic complications, right? Okay, venous ulcers, you can see over here. Okay, there is venous ulcer, as I told you. So remember that venous ulcers have sloping edges. Okay, you will find a lot of granulation tissue. You will find exudation. Okay, and whenever anyone comes with venous ulcer, we always do a biopsy to rule out cancers, carcinomas. Okay, like squamous cell carcinoma or basal cell carcinoma. And as I told you, the most common location of the venous ulceration. So now, anyone who come with venous ulcers, of course, a full workup is needed, full examination is needed, Duplex is needed, like just to see like if there is any obstruction to the blood flow. Okay, and investigations are also needed. For example, all the bloods, C-reactive protein. Okay, uh, anemias, nutritional status, and all this stuff. Because to for the ulcers to heal up, of course, the nutritional status should be better. Should be better. Doppler should be done. Duplex should be done. All these things should be done. How to manage venous ulcer? Again, it's not so simple. Like it's a very, you can say, difficult task. Why? Because first of all, we rule out the cancers, and then what they do is like they do bandaging. Okay, they do the wound caring. So what they do, like they do compression bandaging of this one, or low compression bandaging for this one. Okay, and they keep on checking, like if there is any infection, because if there is an infection we can give the antibiotics as well. Okay, and they rule out the malignancies, as I told you before. So compression bandaging is very important in this one, so that uh, which aid up in healing this ulcers. So that's all about the venous conditions. The most important is what you can say, uh, as I told you, that one, uh, varicose veins in this case, right? So anyhow, I will see you in this next lecture. I hope you understand. Thank you so much for listening.